Healthcare is a huge job creator, not only for our community, but for our country. In Maryland, we have about 290,000 Marylanders that are directly employed by the health industries. We expect in the next 7 years that number is going to grow by 55,000. 55,000. These are going to be good jobs. The reason, quite frankly, deals with the Affordable Care Act. Now, I can tell you a lot of good things about the Affordable Care Act. If you're a senior, you now know that your wellness exam is being covered under Medicare. You know that. Wasn't covered before. It allows you to take control of your own health care needs by talking to your doctor at least annually to manage your health care. If you're a senior and you happen to fall within the coverage gap for prescription drugs known as the donut hole, you know you got a $250 check last year, courtesy of the Affordable Care Act. You know that. This year you're going to get a 50% discount on your brand name drugs if you fall within that coverage gap. And by 2020, we're going to eliminate entirely the coverage gap, which is going to mean several $1,000s for the typical senior that falls within that coverage gap. That's millions of seniors now being protected so that they can take their medicines. That's important to you, those of who are going to go into this healthcare field, because it allows you to manage people's care effectively because you know they can afford their medicines, which is a lot more expensive than hospitalization. If you're a small business owner, you're pleased about the Affordable Care Act and have a reason to celebrate because of the tax credit. Several million small businesses will now be able to afford health insurance for their employees, which they couldn't do that before. If you're a consumer and you now can keep your child on your health insurance policy to age 26, you celebrate the now 1-year anniversary of the Affordable Care Act, or now that you're going to be able to get coverage without restrictions for pre-existing conditions. Can't tell you how many families I've talked to in Maryland who couldn't get full coverage. Family whose child was born with asthma couldn't get full coverage. What's insurance for? Well, we've corrected that. The one I always like to talk about, and I got involved in this, insurance companies could require you to get pre-authorization before you use emergency care. Think about that a moment. You're lying unconscious someplace, and you have this little card in your wallet saying, please do not take me to the emergency room till you call my insurance company. I mean, we've corrected that in the Affordable Care Act. There's a lot of other provisions. We also said, look, insurance companies should use their premiums to pay for your benefits. Seems a little reasonable to me. So we've done a lot of good things for reasons to celebrate. But the reason why you're here today is to celebrate that we, America, at long last, joined every other industrial nation in the world to say healthcare is a right, not a privilege. And as a result, 30 million more Americans, 30 million more, are going to have health insurance. And with health insurance, it means they're going to be in our system. They're not going to end up in our emergency rooms. If you're a taxpayer, you can celebrate also because we're going to cut the cost of health care in America by over $1.5 trillion over the next 20 years. We're going to say that's not what a Democrat is telling you. It's not what a Republican is telling you. That's what the objective accountants are telling us. That we're going to say as a result of the passage of the Affordable Care Act.